reconstruction actually isn't something that's done in one surgery. It doesn't happen overnight. In my experience, I had my double mastectomy, and at the same time, a plastic surgeon came in and put what's called tissue expanders inside of my chest cavity underneath the muscle. And what those do is they're used like balloons. So they're filled with saline about 3 weeks after the surgery, after the double mastectomy or the mastectomy. This can be done in one breast as well. They begin to fill those tissue expanders with saline. And the goal is to stretch out your muscle and your skin that's left. Because basically when they do a mastectomy, they've taken away your skin, so they have to sew you back up really tight, and you've lost all that skin that was in between. And they need to stretch that out in order to form a new breast. So I went through 3.5 months of them trying to stretch out my tissue expanders and my skin and my muscle again. And once that was ready and to the size that I was happy with, unfortunately, there comes a point where it only can go a certain size. You know, your skin will only stretch so much. So mine, we got to the point where I would have liked to make my breasts larger, but they said your skin won't stretch anymore. And so we had to go in to have surgery. And there's a second surgery where they take out the tissue expander and they insert what's a saline or a silicone implant. So basically just like a breast augmentation, however, you don't have your tissue, your breast tissue, and the implant is placed underneath the muscle. And sometimes there can be complications. There can be dimpling of the skin. There can be fat grafts needed, tissue grafts needed. So breast reconstruction can be a multiple surgery process. Mine so far has only been 2 surgeries, which I'm very grateful for.